Hi everyone, Julien here, nurse practitioner for Danesthetics Medical, and our clinic is located here in Ottawa, Canada. Today we're talking about one of the most common treatments in medical aesthetics, which are the nasolabial folds. Believe it or not, this is actually one of the most dangerous areas to treat on the face, and there are a lot of myths out there on how to approach treatments. So let's get into all of that. I'm sure we're all going to learn a few things. Now, before doing any treatments, I'm always doing an evaluation of the face, looking at what's morphed to cause the nasolabial folds and also certain safety measures to protect the client. So to help us with that, let's bring in our assistant, Stuart. What's going on, Stuart? And let's go over the safety measures first. We have a facial artery that starts off right here and it runs up to the nose. Actually, once it branches off from here on, this is now called the angular artery. And sometimes this artery is going to run right in the nasolabial fold itself. Sometimes it's a little higher, sometimes it branches off into two sections, sometimes it's not even there, but most of the time this is going to be right around here in the line of fire, and it's usually on the more superficial level. So that's something I have to keep in mind right off the bat. This area is dangerous because this angular artery connects to the nose, which connects to the eye and potentially could blind someone if you've parked your needle right inside that artery and filled it up with a bunch of filler and you weren't taking precautions. The next thing I'm looking at is the morphing of the fat pads and what's happening to the skull that's changed the nasolabial folds. Well, right off the bat, this is all cartilage here. Underneath that, there's a big hole here in the skull, and that hole opens up and protrudes in on itself. Our face is literally imploding on us as we mature. And our superficial fat pads, which are all here, right? These are all mobile. And these mobile fat pads morph or move towards where the skull is bending to. This is often enough why people come to me and say, can I just get one of these? And that's because your fat pads used to be there, but now they've moved forward and they've actually created this little bunching here. By the way, this nasolabial fat pad here, this is a superficial fat pad that you'll never lose. It actually stays with you over time and sometimes swells, which is another contributing factor to the nasolabial fold. Now, this is where things get interesting because even today, providers will be taught that if you place dermal fillers in the cheek here and here, it's going to provide this type of lift and it's going to soften the nasolabial folds, where in fact that's not true. There was actually a study that confirmed it with 77 patients by placing 3 cc's, which is 3 syringes of filler in a cheek, that it still doesn't lift anything. It just basically lifts the area where it was volumized, but it's not enough to correct any lifting over here or down here. So it's something to think of. Remember what we talked about within the anatomy. You just need to place dermal filler in the nasolabial fold here to prop that up to give the illusion that there's no real nasolabial fold. And remember, you don't want to completely eliminate the nasolabial fold, you just want to smooth it out. Otherwise, this is going to be as high as this, and it's going to look crazy. So take that into consideration. Now, grooves versus folds, and there is a difference. A groove, by the way, is whenever there's a little bit of a hollowing in the nasolabial fold, but the skin doesn't fold over. A fold is whenever the groove becomes pretty deep and the skin starts folding over. At that point, each of them have their own treatment options. Treatment option number 1 for the groove, the mild nasolabial fold. What I'll do here is I'll actually take a cannula and I'll feather some product here. By the way, a cannula looks like a needle, it's a blunted tip, and it's designed to bump these arteries and veins out of the way, so it's really nice, no one ever really bruises, and that's all I need. It gives me a nice little lift right here. I tend to use a high G prime product. Right now I'm really liking the Reveness Shape, which is a Canadian brand, by the way. Very safe, consistent results, and it provides a nice lift right here. Now with folds, I approach that completely differently. A fold, I have to take out my ultrasound, identify exactly where the artery is. I need to know the exact location as well. And most of the time it's going to be running a little bit more superficially, but it rarely touches the skin. So that tells me 2 things. I need to place a product deep onto the bone because that's away from the artery, which I'll do here. This is the example of my fake syringe here. So I'm going to place a product right here, something like Reveness Shape, where it's going to be a high G prime, propping that up. That will treat that by about 40%. And then afterwards, I'm going to take something that's softer, like a Reveness Versa, or we call it Ultra Plus here. And we also have Kiss, which is even a little thinner. And then that I will actually scrape the derm just underneath, and I'm going to place that thin product there just to smooth that out nicely. And that does a really nice job of treating the nasolabial fold. And then I'll do an extra little line right here. So I do this little fan technique where I just go down, retrograde, bead, 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 then go down and do another one right here, just to make sure that this looks seamless and it just doesn't drop off. And by the way, whenever I'm treating the nasolabial folds, I don't go all the way down to here. This is actually a different treatment. This is a similar treatment to what I use whenever I'm doing accordion line treatment. That'll be for another video. But when I'm looking at the nasolabial folds, this is really what I'm looking at here. Now, if you're a medical aesthetics provider and looking for more live demos on real clients, then consider joining my Patreon. It's designed for serious medical aesthetics providers like you, giving you the option of coming to shadow us. So that's it for now. I hope you guys enjoyed this session. Until the next time, take care of each other, exercise daily, and please be nice to absolutely everyone. Cheers.